Hi, Missouri, it's Mary. I'm asking pain patients, loved ones, and medical professionals to please stop and send me an email at mopainadv@gmail.com. And I'd like for you to please help me. I've been asking for people from Missouri who are pain patients to please send an email, and I have not received very many of them at all. And so in order for me to help you, I need for you to speak up and help me. I have hours and days invested in trying to help you. And in order for us to do this, I need for you to stop and submit an email, which would take you probably 5 to 15 minutes. And if you want to remain anonymous, include that in there. That's totally fine. But if you can include your name, it gives a little bit more validity to who you are and that you are a real person. And I also need for you to include your name of your district rep. And I'll include a link that you can put in your address and find your district rep if you're not sure who that is. There are 163 reps in the state of Missouri. And so we would like to try to be able to let every rep know that this is what is going on in your district. So it can be that you have had a total loss of pain meds, or that you are just fearful of losing them. And this is also means for chronic pain, for acute pain, which is after an injury or an accident, and post-surgical pain. And so we're looking for people who have either negatively been affected or fear that they could negatively be affected in the future. And so also medical professionals. If your doctor has spoke out that has said, I don't know how much longer I can write you the script. I'm very fearful because of the government changes that are going on in the state or on the federal level. That's something to send an email about too. So there's been a lot of government intrusion at the doctors, and there's also been practice liability insurance intrusion at the doctor's office, and they also work for hospital groups. Their bosses have been an intrusion. Our patient insurance is an intrusion, and also pharmacies are also an intrusion on the doctor's time. So all of this takes up time from our doctors, and that's less doctor-patient time. We are wanting a total restoration of patients' rights, and we would like to restore everything. It's not our fault of what is going on, and the government is making this out to be more than it is, and so we want to be able to tell them how we are being affected, and also that we would like the doctor-patient relationship restored fully, so that way our doctors can treat us as they see fit. They are the ones that went to medical school, and they can see many times the pain that we do have. So there's not all conditions that have a cure. So we want to be able to have options. The more options, the better. I'm finding pain patients that have totally been dropped from their doctors, and they do not have medical care at all at this time, or they might have been pushed over into pain management, and those doctors are really busy. And when patients go in to see them, they're not getting regular scripts for what they have found that works for them. They're trying new drugs that are more expensive, that seem to have more side effects for most people. And so we'd like the opportunity to be able to restore everything back to the way it was. So in order for me to help you, we need for you to send in emails. And this is a way to get our stories out. I had talked to a state official, and he had said that The doctor should not be cutting any patient in this state because it's only CDC guidelines. They're just guidelines, he said. And I said, well, they are being cut, and doctors are afraid. And he said, well, if patients are being cut, it's probably because the doctor sees that they don't need that medicine or whatever. It's basically, it's an individual basis. I said, no, I've had patients reach out to me and say, I did not want to be cut. I am able to lead a good life when I have pain control options. My pain is tolerable. I can function. But now that they're cutting my meds, I'm not able to do the things I used to do. I'm not able to enjoy my kids and my family, and some are now bedbound. And so they said they have done everything right. I have signed contracts. I have submitted myself to drug testing. I have went to the same pharmacy. I've done everything that my doctor has asked for me to do, and I'm still losing my meds, and I don't know why, and I don't know what I'm going to do. And it's a serious problem. If you don't have pain that you are being treated for at this moment, and you have had pain in the past, don't forget that things can happen in the future. So we do want to be able to also restore rights for any future pain patient, and that can mean our kids, our family. And so we do want to be able to have those options for those people too, that they shouldn't have to fight and fight and fight to get those options. I mean, we've fought for a diagnosis, a treatment. Many of us have went through so many surgeries, and now I'm fighting for pain control rights? Are you kidding me? After everything that we've been through, I've been through, I'm tired of the government saying what is right for me. I'm sorry, I don't think that's fair at all. And so I want to be able to take that back into our own control. And I would like for you to please stop 5 minutes, email me, even if it's someone that you know, a loved one that you've seen have problems getting their meds or their meds filled, or problems at the pharmacy, or that they've had anything going on, or just that you want to make sure that they do not lose those options. So again, the email is mopainadv@gmail.com. Please send this information to other people in Missouri, because we need to restore rights to pain patients and doctors. Thank you.